I had a patient who saw me for prostate cancer. This patient actually had a normal PSA. However, he had abnormal 3% PSA, which is another component we look at while seeing these patients.
Yeah, I was referred to Dr. Nagpal through my wife. She worked with Dr. Nagpal's wife, and they immediately set me up with an appointment through Arizona urology specialist. I was nervous, like most people would be, but he's so calm. And we talked about it, and I said, well, Dr. Nagpal, should I be nervous? He says, don't be nervous. Whatever it is, we'll fix it. And I just hung on to that, and it really worked for me. And he was true to his word. He did fix it.
Biopsy showed that he had a moderately aggressive prostate cancer. And after a thorough discussion with the patient, we decided to proceed with robotic prostatectomy.
So I'd already made my decision before I even left, that office, that I wanted to get surgery. The surgery went really, really well. It's about a 4-hour procedure. The next 12 days was learning how to live, walk around the house, and stay moving with the catheter. So I got that removed 12 days later. And then every 3 months I was going to get my PSA checked to make sure that, it stayed, it didn't increase. And one of the things that Dr. Nagpal told me was the farther you get away from this procedure down the road, that the less of a chance that it'll come back. Usually if it's going to come back fairly quickly. So every 3 months for a year and a half I was doing that, and that's stressful in itself, because you get your lab results sent to your email, and I'm like, do I click on this? Because I was like, what if it's not zero? What if it's up? And same thing he told me going into this. He goes, if it comes back and it's a little bit elevated, we just fix it. That's one thing I always hung on to, in the back of my head, is like, hey, we're a team, and he's gonna make sure that I'm gonna do okay with this.
Patient did extremely well, and he is currently 2 years out of it. He's cured from this cancer. His PSA is undetectable. I treat patients as my family members, and I can reassure them that they will get excellent quality of care. I want to inform them that they're not alone in this, and we are in this together. We'll travel this journey together and make this decision together and have a great quality of care during this process.